Welcome to Pullman Regional Hospital, and thank you for coming to your preoperative visit. The pre-op visit lasts about an hour and is designed to prepare and inform you about your surgical procedure. The majority of your pre-op visit happens in the same-day services department. In a private room, you will meet with multiple staff members involved in your care, primarily our pharmacists, nurses, and lab personnel. Additionally, depending upon your doctor's orders, a respiratory therapist may come in to perform an EKG, which is a heart tracing. You may be taken to imaging services if an X-ray, ultrasound, CT, or MRI is required. For procedures expected to result in a longer hospital stay, you might also meet with our hospitalist, a hospital-based internist who will be involved with your recovery. During your pre-op visit, we encourage you to ask our knowledgeable staff any questions or raise any concerns that you may have. During your meeting with our pharmacist, information will be collected about your medications and allergies. Please notify our pharmacist of any blood-thinning medications that you take, such as aspirin, Coumadin, Plavix, or warfarin, as these medications are of special concern when having surgery. These are not to be taken while at the hospital, but are brought in to clarify any medication questions that may arise. It is important for your safety that our hospital staff is in charge of medication administration while you are here. You will be instructed on what medications to take and not take prior to your surgical procedure. You will also meet with a registered nurse who will interview you and review your medical history. This nurse will provide you with additional information and instructions about your surgical procedure, what preparations you may have to make, and the time you need to arrive on the day of your surgery. The lab staff may come in during this time to perform a blood draw if ordered by the doctor. Next, if necessary, our respiratory therapist may come see you to perform your EKG. You may be escorted to imaging services for additional testing, and if needed, you will meet with the hospitalist. If your surgery requires an overnight stay or longer, you are welcome to bring personal toiletries, your own pillow, reading material, music, or other items such as a laptop computer, which may help make your stay more comfortable. We have free Wi-Fi access for you and your family or friends to use. General instructions before surgery. There are some general instructions that are important for everyone to follow before surgery. Do not eat or drink anything, including water, nor chew gum after midnight the night before surgery. This is so important that if you do eat or drink after midnight, your surgery may have to be canceled. Feel free to brush your teeth and rinse your mouth the morning of surgery, taking care not to swallow anything. Do not drink alcoholic beverages in the 24 hours before and after your surgery. If you smoke, try to quit or cut down before surgery. This will allow your body to heal faster and reduce your risk of complications. Notify your surgeon's medical office if you become ill. A bad cold, chills, fever, or signs of infection may cause a postponement of the surgery. Take a shower or bath the evening before or morning of your surgery, following the instructions for the antimicrobial soap provided for you. Do not shave any hair in the surgical area. In the operating room, special antibacterial soap will be used to wash the surgical area, and at that time the surgical area will be shaved if required. Leave all valuables such as jewelry and money at home. Remove all body piercings. Wear comfortable, loose-fitting clothing to the hospital. Do not wear makeup or nail polish the day of surgery. On the day of your surgery, please check in at the information desk at the front of the hospital. You will then be escorted to the same-day services department and be asked to change from your street clothes into a hospital gown and slippers. 1 or 2 family members or friends are welcome to stay with you until you go to surgery. A registered nurse will complete a brief physical assessment and confirm the information in your medical record. Prior to going to surgery, you will be asked to remove any dentures, contact lenses, jewelry, and all body piercings. If you're allergic to any substances or medications, a distinctive wristband will be placed along with your identification wristband. We will then start an intravenous or IV line, which provides a route for giving fluids and medication before, during, and after surgery. An important part of your surgery is anesthesia. An anesthesia provider will talk with you on the morning of your procedure to explain your anesthesia options. The anesthesia provider will help you decide which anesthesia is best for you and will determine if any medications are needed prior to your surgery. You may receive a medication through the IV, which will help you relax and ease preoperative anxiety. Before going to the operating room, an OR nurse will review your chart, double-check for allergies, and ask other questions that are vital to your safety. Operative phase. At the appropriate time, the OR nurse will bring you to the operating room where you will be helped onto the table and covered with warm blankets, since this room is a bit cool. The operating room is staffed by a team of professionals and provides sterile equipment and safe surgical surroundings. You may notice that your doctor and surgical staff are wearing special gowns, masks, and gloves. This is necessary to keep the equipment and instruments sterile. The anesthesia provider will be at your head during the entire operation. He or she will attach some patches to your chest in order to monitor your heart. A blood pressure cuff will be placed on your arm and a small clip placed on a finger to monitor the oxygen level of your blood. You may be given some oxygen with a mask or through a small tube under your nose. Your anesthesia will now be administered and the surgery will be performed. While you're in the operating room, your family and friends will be in the waiting room. When the operation is completed, your doctor will speak to them. Post-operative phase. After your surgery is completed, you will be taken to the post-anesthesia care unit, also known as the recovery room, where a registered nurse will monitor your vital signs while your anesthesia wears off. As you are awakening, the nurse will encourage you to take deep breaths and cough in order to clear secretions that may have settled in your lungs during surgery. During this immediate post-operative period, you may experience blurred vision, chills, a dry mouth, and increased sensitivity to noise. The area of surgery may hurt or burn. The nurse will ask you about pain and is ready to give pain medications that your doctor has ordered. You will remain in the recovery room for approximately 1 hour and then be returned to your bed in either the same-day services area or to your hospital room if you're staying overnight. If your surgery only requires a local anesthetic, you may bypass the recovery room and return to the same-day services area where you will remain until you are ready to go home. Your family members or friends will be allowed to see you now and stay with you if desired. After returning to the same-day services area or to your hospital room, nurses will continue to monitor your vital signs, dressings, drainage tubes, fluids, and IV line. If you experience any pain, nausea, or any discomfort, report it to your nurse, who will administer prescribed medication and help with other comfort measures. Pain control is an important part of your care. Deep breathing, coughing, and leg exercises are encouraged to promote full lung function and improve circulation. You may be instructed to use an incentive spirometer, which encourages you to take deep breaths. The nurses will assist you in getting out of bed and walking or going to the bathroom if needed. Your doctor and nurse will decide when it is safe for you to go home. You should be able to drink and tolerate fluids, get up and walk a short distance without feeling faint, and have good pain control before leaving the hospital. Prior to discharge, the nurse will give you and your family and friends specific instructions on activity, diet, medications, care of dressing or tubes, doctor appointments, and phone numbers to call if you have any questions or problems at home. Because of the lingering effects of your medications, you may be escorted to your car in a wheelchair. Please plan to have a driver available to take you home, as you will not be allowed to drive yourself. For your safety and comfort, it is recommended that someone stay with you at home during the day and night following discharge from the hospital. Any questions you may have about your surgery, treatment, recovery, or discharge instructions are welcome throughout your hospital stay and after you're home. Please let us know if you have any questions or concerns. Thank you very much.